Welcome back to Massage Wise, and this is part 3 of our massage client bootcamp, which is pretty much the end, because after you've received the massage, there's nothing much left except for aftercare and instructions for what you need to do if something goes awry afterwards, because at this point there's very few things that can go wrong, but if it does go wrong, you're going to need to know. Okay, at this point, you've received your massage, and depending on what type of massage, depends on what type of aftercare that you're going to need. So let's say you had a average, light to medium pressure, no specifics sort of massage, head to toe kind of massage. You just wanted to fall asleep on the table and feel relaxed and comfortable. You're going to, in that case, want to drink about 8 to 16 extra ounces of water to help flush your system, because when you relax, you change over your body's operating system from your fight, flight, or freeze to rest and recover. And so those extra ounces of water will help clean your system out so that it enables you in the next morning to feel better. Now, if you had between what I'd like to call a 1-star, where it's like one area, to like a 5-star, which is like 3 areas, or if you need to have a entire overhaul. So in that case, it would be like your lower back hurts, but so does your neck. And so what ends up happening is you have medium to firm pressure the whole of lying on your back, on your front actually. So in this case, you're going to want to, in addition to drinking your 8 to 16 ounces more water, you're going to want to take a hot bath before you go to bed. And if you do bath salts, pink salt mixes are pretty stinking good, and I recommend them. There's also like the Dead Sea salt mixtures, which is good, but like if you're like me and you're on a budget, you'll typically stick to Epsom salt. I mean, you can get it at the Dollar Tree for like $1. So 2 cups in a bath. Make sure the mixture is well put in if you're just going to hop in and soak. If this is part of your cleansing routine, what I can suggest is that you, in addition to having a portion of it already in the water, you 50-50 mix the product. So your body wash, your shampoo, and your conditioner. You use little bits of Epsom salt in your soap so that the Epsom salt is right against your skin. Because when you're washing, you're also removing minerals from your body in that your pores are open. So using the Epsom salt as a 50-50 mix in your shampoo helps put magnesium back into your system. Same thing with your soap, same thing with your conditioner. And then soaking for about 5 minutes afterwards definitely helps. A big indicator to tell you soaked long enough is that your fingers and your toes become like really pruned. It's like you've been in the pool too long or out in the ocean too long. Once you've reached that stage, pretty much you can get out and relax. If you've had a lot of deep work, and like I will continue to say, deep pressure is not the same as deep tissue work. Deep tissue work doesn't necessarily need to have deep pressure. Then you're going to want to, in addition to the soak, in addition to the water, you're going to want to make sure that you get a good amount of movement in. And if you're not a vegetarian, I would say, hey, eat a good protein-rich diet, because the proteins that you're ingesting assist in repairing the muscular structures that deep pressure just went over. You're going to want to make sure that you don't overdo it, because you can overdo it, and that makes for a very smelly night's sleep. But other than that, I really don't see too much of a negative effect. So water, bath, protein, and get a good night's sleep. I know it's really hard for some people, especially if your brain doesn't turn off like mine, to get a really good night's sleep. But it is an investment in your health and your body's functionality. Dizzy, my head is spinning. Now, a couple of things that can go wrong, not that they will more often than not, but this is just to prepare you just in case, is you're getting off the table too quickly from a massage, especially if this massage is more than an hour long. Your body has relaxed to the point where your heart isn't going to be able to react quick enough for some things like getting off the table too quickly, where your heart has to go from a certain rate of keeping relaxed in beats per minute for blood flow when you're lying down versus beats per minute when you have to go from lying down to immediately standing straight up. You're going to get a little dizzy. So the easiest way to do that is to get off the table properly. And by properly, it's 2 or 3 steps. One would be you roll onto your side and you tuck your knees up as if you're sitting on a chair whilst you're on your side. And utilizing your legs as leverage, slowly put your opposite arm, so the arm facing towards the wall, to the opposite side to slowly push yourself up. This will enable your heart rate to actually stabilize a little easier going from laying down to sitting straight up. That way, if you're also dizzy, you just go back to laying straight down onto the table rather than, falling on the floor. That is no fun. Etc., etc., etc. Let's get on with this. And finally, a quick reminder to everybody who doesn't already remember or understand. Massage therapy, when done correctly, will lower your blood pressure, will lower your blood sugar, and will cause the body to be in a state where it's not going to jump from one thing to another quickly. When you're in your rest and recover state, you are not in that survivalist state of fight, flight, or freeze. So when you're getting done with your massage and you're relaxed, get off the table correctly, take a minute to take a breath in, and walk around for a couple of minutes before you operate a motor vehicle. This is to make sure that you don't fall or get injured, because we want you to return and get another massage because it's that good. So if you're diabetic, be mindful and just in case have like a sugary treat in the room with you, if anything possible, more than just a little, because blood sugar dropping, if you're in a situation like that where your blood sugar drops to next to nothing and you could go into a diabetic coma, you don't want to do that with your therapist. You want the therapist to first and foremost know about this, and secondly, have those treats on hand. The therapist is not going to get mad if they have to give you your treats during a massage rather than have to call an ambulance because you've gone into a diabetic coma. Alright, so that's all I got for you today. And just as always, if you like the content you have here, because the algorithm can be a bit of a pain in the butt, do subscribe and hit that like bell and give me a thumbs up. And if you have questions that you would like me to answer as a massage therapist on this channel, feel free to drop them down into the comment section and we will get back to you again in about a week and a half. Maybe. Yeah.